What's going on, people? It's Robert Thompson-Eshun here. I am currently a pharmacy student at St. John's University, and I actually want to talk to you guys about the movie that just came out on Netflix.
I'm Dan Schneider, and I'm a pharmacist. I can almost remember every piece of my life. I have hundreds of hours from wiretapping phone conversations about what happened to me.
This movie is about a guy named Danny Schneider, who happened to be a pharmacist back in the olden times, before the 2000s. And basically, this is before a lot of the pharmacy regulations are in place now. So before we get into talking about the pharmacy related stuff, I want to just talk about the main movie impressions and what I think of the movie before I start spoiling it. So before the spoilers come about, I want to say that I actually enjoyed this movie a lot, even though I don't like crime scene movies. Like, it's more like a crime scene thriller movie, and as well as like a documentary kind of movie, which I like documentary a lot, but this one's kind of like crime related. And I think that this movie can actually, in the first episode especially, when he talks about his son, that part of the movie literally will make you cry, or like you're gonna feel like a heart drop, or like you're gonna feel emotion basically from that beginning part when he talks about his son. And as well as when you hear the way that the narrator talks, the narrator is the main character, Danny Schneider. When you hear the way he talks about certain topics and like what his life goal is and like how he's pursuing it with such intensity and detail and everything, this thing like actually makes you want to like understand the character. And that's something that I think made the movie so good, because you can tell this character was obviously very inclined. This is literally his life's work, and you can see it, everything, and the way he talks and the way he acts. And you can see it in other characters as well when you see their emotions about each topic. So overall, this movie definitely, I'll give this like at least an 8 or 9 out of 10. It's not a movie, it's like a television series, but I would definitely give it like 8 or 9 out of 10, because overall, like, the amount of impact it has on the US as well as healthcare in general is impacting very, very highly.
At first, my mission was to get justice for my son. But then I started noticing in the drugstore, a lot of kids around my son's age coming in with high-powered opiate prescriptions for OxyContin.
Word on the street was, it's just heroin in a pill.
So, the first episode was basically about the guy named Danny Schneider and his son, who is like an average kid. But the setting place is that basically the kid was like any other kid. He was young, he didn't really, he got involved with the wrong people and ended up doing drugs, and that ended up killing him. The person that actually killed his son was the guy that was selling him the drugs, which is something that is very, very likely in a lot of cases. I've seen a lot of my friends get involved with that, and I've seen a lot of my friends actually die from that same scenario, which is why I endorse not using drugs as much as possible, especially illegal drugs. But that's another story for another day. It's so easy to get robbed, it's so easy to die, and that's not the point of the story. But he's in a bad scenario, and I think it's very important that like you see the amount of work the narrator puts into it, because this guy, I think he's one of the most interesting characters I've ever seen in my life. Because this guy, Danny Schneider, literally had video recording of most, if not all, the conversations he had with every single person that was involved in everything involved with him.
There were boxes and boxes of materials.
All right, Dan. Would that be recorded again already?
No.
So he has every phone call from him talking to the police officers, the way they're treating him, everything. And that makes him probably the most interesting character I've ever seen in my entire life. Because if you think you like got a gold mine, this is it. Like, if you're literally gonna talk about a movie about a guy from Netflix or any documentary about a person, and they literally have video recording, tape recording of every single conversation. Oh my gosh, like, this movie is so crazy. I think that's one of the best parts about the movie, is that the fact that this guy, Danny Schneider, literally has recordings of every single thing. And after you hear about the son dying and how it happened, basically he becomes like a private investigator, and he basically figures out a way to contact the guy, and he figures out who killed his son, and the guy actually goes to jail. The next part of the show talks about the main focus of the movie itself, which is about him actually going against the opioid crisis. And honestly, this has such implications into the way that healthcare is done nowadays that I think it's very, very important that most people in the healthcare field, as well as any person in general, should understand this. Because there's so many implications now in healthcare, especially as pharmacists, They have to learn about opioids and how the usage of it is. And this movie shows the highlights of it before it actually became an epidemic. Dr. Danny Schneider, literally goes about and talks about how he saw the implications of these kids taking, like his son Danny, taking these opioid drugs at such high dosages and seeing the adverse effects of it.
I saw this opiate epidemic in its infancy. I'm not gonna let this drug continue to kill.
Me being a pharmacy intern in New York, I see this a lot, and it's very, very important because New York City takes the issue very, very seriously. So basically what happened was that this doctor named Jacqueline Cleggett was basically dispensing drugs as a pill mill. And basically that means that this doctor was basically giving you medication if you ask for it. If you ask for anything, Oxycontin, you got it. That's it. You pay her extra money, you got it. And that's terrible overall because it can lead so much to addictions. And I'm gonna also list out right here the addiction profile of all drugs from C1 to C5, which is how all drugs are categorized. And I also think it's important to understand that Oxycontin 40 milligrams is probably the highest dose, and it's something that's very, very important to talk about because pain is a hard topic for anybody to actually assess, and it's impossible almost for anybody to tell you how much pain you're in, which is why this is such an alarming issue because anybody can say they're in pain, and there's no way you can really test if someone is actually in pain. So that's where the problem becomes, because if I say I'm in pain and my pain's not recovering, as a healthcare provider, your main goal is to help me as a patient relieve that pain. And then the main goal as a healthcare provider is that you start hearing this a lot when you're in healthcare, is that you hear risk versus benefit. So is the risk of this drug that you're taking worth the benefit of relieving your pain? If you're in chronic pain every single day, I would definitely try my best to try to relieve the pain as much as possible. That means it gives you the therapy that works best for you without causing adverse effects or minimizing adverse effects. So it becomes the issue because no one can tell you that. So it can be hard to do that, but like no one can. So like when the doctor Danny Schneider started coming in, he started asking patients like, how would you say, how severe is your pain? Is it on a scale from 1 to 10? If your pain is like not like a 7 to 8, you shouldn't be taking Oxycontin because adverse effects of it are so high, and it's so documented nowadays that it's like ridiculous that anybody even prescribes nowadays. Like if you prescribe that, it's a red flag immediately in anybody's system. I don't care where you go nowadays, that's a red flag. So that's why nowadays you see programs like the iStop program, and that's basically the PMP program, which basically tracks the medications you take that are C2s or high abuse potential medications. These are the medications that a lot in New York City especially, they literally track you on the day and how many pills you get every single time. In the pharmacy system, the doctor system, and as well as the insurance system, all can see this PMP stuff. And that's where the main issue of this comes into play. Back in that time period when Danny Schneider was a pharmacist, this is not in place. This is why this is an important movie, because this guy literally started his own PMP system and literally started seeing the times and frequency of people coming in, and then people are selling it or people that are taking the medication. And that's why this is such an important movie to watch. And this is another issue why also nowadays doctors can't even prescribe their own meds. Like if you're a doctor, you can't even prescribe your own C2 medications in New York, at least New York City. And that's because of the abuse potential, because it's so easy for a doctor to be, back in that time period, to be like write scripts. The doctor talked about the movie eventually, like she literally handed a guy a notepad of just scripts. Like you literally can write anything you want. You can literally write down any drug you wanted and you give it to the pharmacist and they can dispense it for you, which is insane, which is highly illegal. And this also became an issue recently, actually, if you don't know, in New York City especially, the fentanyl emergency, and the main way that fentanyl was used is also being abused. It has been a recurrent issue in New York City especially, which is why I want to talk about something real quickly. So basically, if you're taking a medication that is a C2 medication or drug-related abuse medication, the only way or the main way that you prevent this, if you see someone with this illness, is to getting Narcan or naloxone. Let's just zoom in real quick to this. Narcan or naloxone. It's very, very important, especially in New York City, to be and understand how to use medication, as well as it's such a big issue, especially with the fentanyl issue, is that any person nowadays can get this medication from any pharmacy and pay for it without insurance or a prescription. So if you really are in a situation where you know someone is taking an opioid drug or a drug with high abuse potential, it's very, very important that you get this medication, naloxone or Narcan, and you understand how to use it properly. And it's on the instructions are on the side of it as well. So if you want to know how to use it, the instructions are inside of it. And make sure that it's not expired as well. And try to give as much as possible. So when you learn how to use medication, make sure that you actually use it properly. And that's the main issue I want to talk about with that. Okay, so in the movie The Pharmacist, it's very sad. And especially the first episode when he talks about his son dying, and you can kind of see how the son dying plays a role into the rest of the episode, because throughout the entire time they constantly show how his son dying relates to other topics, and you can see it in the way he talks and the way that the Netflix movie does a good job of doing this as well, relating each of the topics to the son dying, because that's the main motivator for him doing all these things. Or like his son that didn't know what they were doing, or just want to get high, or just want to have a good time, and they were using your drug that can honestly kill them. And that's actually what it was. If you look at how many people died from the opioid epidemic, it's astonishing that this actually happened. But it's very, very important to understand this as well. And it's also very important because nowadays, recently, the fentanyl problem that occurred in New York as well as across the nation, it's very, very important that you understand how to use medication, as well as understand which medications are bad for you or shouldn't be taken for you. I also think it's very, very important as well that whenever you take any medication, even if from a healthcare professional, is that you understand it yourself. And one thing that's astonishing to me was when he talked about how the Purdue Pharmacy, which is the pharmacy that created the opioid OxyContin, they had their own treatments for opioid related adverse effects, which is astonishing to me because they're the ones that caused the problem, and they're making millions from it, and then they were offering treatments for the issue that they caused, which is mind-blowing, to be honest with you. But it's very, very important point that, like, if you're a regular person and like you don't know anything about drugs, pharmacies in general, it just gives it a bad name. Like, you're honestly just like giving someone a pill that you know is gonna cause them to become abused, and then you're gonna offer them a treatment for it. Like, what? That's like, bro, what? But anyway, overall, the main point that I wanted to talk about was that the fact that this movie should be watched by every single person, if not every single healthcare professional. And I also want other people to understand that there is a way to negate the effects of an opioid using Narcan. And overall, I just want you guys to understand that this movie is a great movie to watch. If you guys want to talk about the movie some more, leave it down in the description down below, or leave it down in the comments down below. Sorry, wow. This is a great movie to watch overall about addiction, and as well as understanding the pharmacy system. But I want people to also understand that pharmacy is a great system. Many medications are used to help people every single day, and that it's not always as bad as people think it is. Because there are good people in pharmacy, and as well as good people in healthcare professional, as you saw by Mr. Danny Schneider, Dr. Danny Schneider. And I like this movie a lot because it shows the pharmacy career in a good light, and it shows that every single person in the healthcare profession is there to help people. When you start in the healthcare profession, most, if not every single person is there to help somebody. So like when you see your doctor, when you see your pharmacist, when you see a nurse, every single person is there to help you. So treat them each as an important individual, because we all make mistakes and we all do things incorrectly. But like if someone tells you something about as a healthcare professional, take the advice and talk to other healthcare professionals, or look it up yourself in the right fashion, of course. But every single day is there to help you, so just take the advice, or at least look it up yourself. And with that, I'm gonna end the video off here by saying thank you Netflix for showing this movie off. I appreciate it, showing a good light on pharmacy as a career path and a healthcare path in the future. And subscribe for more videos weekly. Catch you guys next time. Bye.